Hello my dear girls, this is a video for overachievers. This is a video for girls who wants to do extra neck, who realized maybe by looking at the before picture that the chest is a little bit rounding, the head is forward, or you have very straight back with something like this happening. Anyways, at both of these cases and many other scenarios, the lymphatic flow together with subclavian artery and lymph nodes in this area will be compromised. Plus, if we want to fascially change our face, we need to make sure that the rest of the fascial network is ready, right? And if you don't have available back of the neck, unfortunately, without working and lengthening this area, you will never be able to lift and place where it belongs, your eyebrows, your forehead. This is all interconnecting. So I hope we understand that before thinking and be very upset about one wrinkle that doesn't go away, we need to make sure that the base is more optimal than now. So this is a super effective and very easy complex. You can do it more than once per day, as many times as you want. And we start with lifting the shoulders straight up. You're lifting the shoulders straight up, and this hand, the opposite hand, is pushing slightly shoulder down, well, towards the back. But this is not happening because it's just because a lot of you, when you share the videos and you do this exercise, you bringing it somewhere here. The shoulder is already too forward. No. The chest is up. The chest is up, but the ribs are not open. No, the back of the chest is up, and the front and the upper chest is high. You see how far away my shoulder is sitting right now, and this is guarantees a better flow from my head. So you have it here. This hand is reteaching your nervous system together with some post-isometric exercises that working with the fibers. So you lift in your shoulder, you have in your hand here, and you lower in your head, making all of these folds. It's totally normal, please don't panic. You stay here for 5 seconds, then the hand goes down, lowering your shoulders. This shoulder you're also making sure that it's not somewhere here now, and lengthening this side of the neck for 5 seconds. Now we will do it more dynamically. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Make sure like there is a strength that lifting you without compromising the side of your neck. Third time. 1, 2, 3, 4, 5. And breathe. Remove your ribs away from your hips. Lift here. Have more open roads. And the last time. Super good. Compare to sides, and let's go again. Shoulder up, slight press toward the back. You lowering it. 1, 2, 3, 4, 5, and 1, 2, 3, 4, 5. Breathe. And get ready for this mini complex that is super effective, especially if you're just at the beginning of the path of this beautiful journey. 2 more times. Open the chest. Even if your goal is lengthening the back of your neck without helping with your chest, you cannot do it. It's about the balance between all of the sides. Now take your knuckles or your hand if it's too much and start massaging your chest muscle. But again, make sure if you are next to the wall, make sure that you are somewhat straight, but you are not too straight. You don't have too much of the angle here. The back of the ribs are also very high together with the upper ribs, and shoulders are down, and in this position you are massaging it. You realize that after you do exercises, you most likely go into your favorable by body for now pattern. postural pattern. So make sure that when you do the exercises, you are in the best position as possible, because this is how we slowly reteaching your system. And we need to understand that the all changes that that are going to happen slowly, because this is a living body. You know, for your nervous system, it's very traumatic to have very big change happen immediately. That's what trauma is. So we slowly, we don't need to do glows 5 times per day, no, but we should be doing it at least once. This is a compounding result with the rest for the body. Now you take your hand and you go 90 degrees to the wall, to the door, wherever it's available, and you press in with your little and ring finger, so to activate this side of the muscle, the serratus anterior, and to feel that actually if you in this position pull this down, your scapula also pulls down and your shoulder is nicely sitting where it belongs. So you place it like this, you have this again, this beautiful angle open for the good flow. You're going to start moving your hips together with your chest. No need to break your back, to rotate just comfortably. And now you're gonna look at your hand, and together with looking at your hand, your massage hand gonna go and iron the chest muscle while this is pressing, this is down, and your head will be going this way, like it's one line, and your head is just making this by, we're working with the platysma as well here. So let's start. First you're looking, you're giving yourself a slack, and then very slowly, one pass, one turn. We're gonna do this 10 times. Make sure that your tongue is on the upper palate. Of course, when I talk, it's very hard for me to have, but make sure that your tongue on the upper palate. Press with your little finger. And let's do the second side again, 90 degrees. 90 degrees, I'm comfortably turning away, and I'm starting my passes. You can do these exercises separately. I expect you to know these exercises by the next 30 days, but don't feel overwhelmed, and if there is limit of the time, do glow. But if you can add extra, this is perfect. Great, now we worked with this, and now we're working with the trapezius. Very similar exercise that we did with a little bit of the details. If it's available, you're gonna take your fingers and you're gonna place it next to your spine, not on the bones, but in the meat. And you're gonna like dig in and slide down, like slide down, like you're trying to get in and pull the muscle down. Of course, our back muscles are holding the whole body of ours, so you're not gonna be able to actually pull it down. But the idea to activate your lower trapezius, to have that while you're doing the trapezius release, is amazing. So you are giving this amazing idea to your body. And now you're gonna do the same. Bring your shoulder up towards the back, bring your shoulder up towards the back, head goes like this, then 45 degrees, and lower it. I see, girls, how you're doing it. You are not bringing the shoulder up, or you bringing it either up or either towards the back. But this is 2 movements in one position, and we're standing here for another 20 seconds, and then we're gonna release it and stretch it. And we're gonna do the same here. Girls that are struggling with the hooded eyes, 3 times per day, trapezius release, please. If you want the result, as I say yesterday, please make sure that you do trapezius release. Relax for a second now, but with the palm this way, you're gonna bring your head and stretch it like this, really releasing all of this. Breathe. This shoulder, the one that is helping with the hand, is also down. Breathe. And now we start with the massage. So especially this area we're interested, we place our hand and we stretch them apart. Again, don't do it here. We keep our shoulders as relaxed as possible. Very slow. Get into the tissue and go. Super good. We keep working on this side right now. We're going to start making this roll from the sternocleidomastoid. This is the skin. We're trying to make bigger one, but we're not going to move the sternocleidomastoid. We're just going to take all of this subcutaneous fat that you tend to fibrose and roll this fold towards your back. Then on the back, you're taking a bigger fold, and the one that takes the whole length of your neck, and you just working on the fat, on the muscle. You palpating it and you lengthening it. You palpating it and lengthening it, and checking for any tight spot. And again, take the roll and go with this first little roll, because I'm interested in the beginning of your sternocleidomastoid. And then when you get towards the back, you're making a big roll. Big roll that you lengthening it like this. Very good. Now take a second and compare two sides. You should be feeling more space. If this is one of you, check your eyebrows. If your eyebrows sitting higher, that's one of the reasons, because your sternocleidomastoid is pulling on your temporal bone, and that's changing the position of all of these bones, and eyebrows sitting higher, or changing the tension of the temporalis, and its eyebrow sitting higher. So, not the eyebrow. Eyebrow is a victim. This is a powerful, guys. Good. Let's do it again. Catch lower trapezius or anything that you catch. Bring the shoulder up. Make sure that everything is away from the hips. Shoulder up towards the back. Shoulder up towards the back. 45 degrees. And go. This is not, I'm continuously bringing my shoulder up. This is not static position. Breathe. A little bit more. And a regular stretch. Make sure that this shoulder is not getting affected by this. 10 more seconds. Very good. And stretch of the trapezius. Again, get into the tissue, get into the meat, and slowly move. Only when the tissue letting you. If you're gonna do it very fast, you're gonna go too superficial. If you find the spot that's extremely painful, press on it for 30 seconds. Squish it. And then continue. Then start with the roll. No pain, no pain. If you feel nervy pain, we don't work on pain. Sensations is okay. Pain, especially unbearable, is not okay, girls. Now big roll. You can tilt your head towards the back a little bit to catch more inside of the fold. And continue. Now, strong massage of the occipital beginning right here. And when you massage, I want you to like lay on your hands. you're going to really lift on, really try to lift, lift this tissue, lift there where the muscle connects to the occipital bone. All of these structures do get tensed together with a natural ligament. So we're lifting it, like you're trying to lengthen, send the tissue back. Very good. Now we're doing the massage for the C7. Important. When you do the massage, you lift in your chest, but you are not lifting it by bringing your ribs up. You're lifting it by having your still ribs down and lifting this. How are you going to lift this? You're going to lift it with the shoulders and then subconsciously, without dropping the chest bone, you're going to hop, just drop the shoulders. Shoulders. And you're going to do this while your hands moving towards your C7, getting this fold, and you making sure that you lift in the chest while this is happening, and you do a squish down while the chest is doing the best. Here is a magnet that lifting you diagonally, lifting. The magnet is not here. This is not what I want. I want this. So lift it, drop it, and go. Shoulders, and then very light, like you would pet a cat, like you would pet a little, just lightly on the whole neck. You can slow down, very light touch, just going this way, very light touch. Move your hand, also very light, super light touch, like all feathers, or like you would pet a little kitty that just born. And then just light pressing here. Again, have your hand, hug yourself. You did a great job. Lower your shoulders, make sure that you breathe in correctly, and great job for doing something extra. We all need this daily. Good job.